In this video, you will be learning about depression and suicide prevention. We will address questions like, what is a depression and why it can lead to suicide? How a person's mental and physical functioning changes when they are depressed? What are the main reasons why people usually commit suicide or want to do it? How suicidal persons see the situation themselves? And what do they expect from other people? An important disclaimer is that suicide can and should be prevented by health professionals. Please visit hospital if you have suicidal intentions or call a hotline in your area. You can find crisis numbers for Finland on the screen and more information in the description for this video. The purpose of this video series is to spread awareness about mental health. What is a depression and why it can lead to suicide?
Depression is a serious mental health illness, and it can be caused by many different reasons. It can be caused by lack of sleep or like a lot of pain, or somebody might have a medical condition that contributes to them getting depression. People can get depression from a difficult childhood or relationship difficulties at the present moment. So maybe romantic rejection, or something like a divorce or a breakup, like social rejection. Many things can contribute to depression. For example, even just moving to a foreign country and not having a job or feeling useful or worthwhile can also lead to depression, obviously.
Mm-hmm.
So what is it? Well, it's considered to be like one of the most serious mental health issues that you can have. And by definition, depression is when you feel sad or depressed every day for at least 2 weeks. And also with the sadness and depression, you would feel suicidal, or have suicidal thoughts, or have self-harm or self-harm thoughts. And the reason that depression leads to suicide or suicidal thoughts, it's not completely clear, but it's part of the severity of the condition. It's part of the distress that the person experiences. It's part of what happens in depression, which is your brain cells are actually dying and shutting down, and there's a like closing down of your brain system. You start to see things in black and white, perhaps, or things seem less colorful, or your focus is kind of much smaller kind of focus. You don't kind of look up and around at the world. You narrow your focus into certain things. And if you've got something to focus on that's quite negative, so, something tragic that's happened in your life, or rejection, or absence of positive things, stress, lack of sleep, pain, your focus just remains on those things. And as a result, for a few different reasons, suicidality can appear, and suicide can seem like a good option, especially if the person's in a lot of pain. But also, we know that suicidal thoughts are a symptom of depression, and that's how I usually treat it, that a person who has suicidal thoughts has them as a symptom.
Could you tell more about how a person's mental and physical function changes when they're depressed?
Yeah, sure. So people will tend to have a much narrower focus, like I said, but there's some really specific symptoms that people get in depression. So physical changes can include like accidentally losing weight because you're not eating very much, or it could be the opposite. It could be that you eat excessively and you eat too much and you're always hungry. It could be that you sleep much less. One sign of depression, especially depression that's caused by stress, is people waking up at 3 or 4 o'clock in the morning when they don't want to, and so they sleep a lot less, or just generally less sleep. Or it could be a person who's sleeping too much. They might just be sleeping like really excessive hours, like 10 hours or more a day. Those are some of the physical changes. And then some of the emotional changes are feeling hopeless, feeling worthless and guilty, often like feeling guilty about a lot of different things, feeling sad and depressed, as I mentioned, also having like a difficulty concentrating. So a lot of people find that maybe if they're trying to do schoolwork or study or even their normal job, they find it really hard to concentrate. Fatigue is actually another one, which I guess is a physical symptom. So they feel quite tired, lethargic, and it's hard to start things or get things going. There's a lack of initiative. And then a really terrible symptom of depression is what we call anhedonia, which is loss of pleasure. So you might be doing something that you really enjoy normally, like talking to your friends or watching a movie or listening to music or going for a walk, but you notice that you're not enjoying it, that the feelings of pleasure are not coming through. And that is a symptom of depression. It's a terrible symptom because it often discourages people from doing those nice activities. But it's a sign that you probably have depression if you start to lose interest or pleasure in the things that you used to enjoy.
Mm-hmm. What are the main reasons why people usually commit suicide or want to do it?
Yeah. There are a few reasons. I would say that from my experience, there's about 3 main reasons. The first main reason would be like mostly everyone, which is that they have like such severe depression, like such strong feelings of all those symptoms I mentioned, like lack of pleasure in life, hopelessness, guilt, feelings of worthlessness. You know, their body is under such incredible stress. Like in some ways, depression is considered a chronic stress disease, that if you have a lot of stress in your body, there's inflammation through your system, it affects your brain. As I said, the cells in your brain die off. These are the cells that are created new every day, and so if they die off, you start to just have like less interest in the world. Everything looks worse. And so if you're in this state, it's very painful, it's very awful. And I think that's when suicide feels like a reasonable solution, because it's such an awful situation to be in. So people might get to suicide by just having such terrible depression symptoms, especially the hopelessness. It would make sense if you feel completely hopeless, that suicide seems like a solution. The other reasons for suicide, sometimes, occasionally, it can be like a problem in relationships with people, and the person feels like suicide would be a way of showing people how distressed they actually are. So like a cry for help. So it might be like an attempt, a suicide attempt, or they might be very serious, but the purpose can be more about the effect on other people.
Kind of letting people know that I'm doing very bad and please help me.
Exactly like that. The third reason that people might want to commit suicide is also a bit more rare, but it's, I guess, an existential crisis. So some people may have an existential crisis where they don't know why they exist, why anyone exists. They don't want to be alive, and they may or may not have severe depressive symptoms, and they may or may not care what other people think. So that would be the third reason.
What is existential life crisis?
So existential means like, what's the point of life? What's the meaning of life? What's the point of existence? So existential crisis is when you question those kinds of questions, those kinds of concepts, like you question, like, what is the point of everything?
Okay, thank you. Could you tell more about how suicidal person sees the situation themselves and what they expect from other people?
Yeah. So I think the suicidal person, like in most cases, will be feeling just incredibly bad. They will be having like a loss of pleasure, they'll be feeling sad, they'll be feeling depressed, hopeless. They're not really thinking of the bigger picture. I think that for a really depressed and suicidal person, the focus, because it's so narrow, it's often also turned quite inwards. I don't think they're thinking about other people. They do, of course, ask for help, which is great, and they do expect other people to help. And so when they approach other people and talk about it, that can often be quite an effort for them. But generally speaking, they're just in their own, world of pain in many ways.
Mm-hmm. Thank you.
Yeah.
And thank you everyone for watching. And if you made it this far,
subscribe.
Bye.
Bye-bye.